Type 2 diabetes mellitus, or T2 German marks, is a chronic metabolic disease. It develops when the body's cells become resistant to insulin, and later the pancreas cannot produce enough insulin to keep blood glucose normal. Insulin is a hormone produced by the beta cells of the pancreas. Its main function is to move glucose from the blood into body cells where it is used for energy. When insulin cannot work properly, glucose remains in the bloodstream. This causes high blood sugar, also known as hyperglycemia. Type 2 diabetes accounts for about 90 to 95% of all diabetes cases worldwide. Type 2 diabetes is one of the fastest growing diseases in the world. It usually develops after the age of 30, but today it is increasingly seen in young adults and even teenagers because of obesity and unhealthy lifestyles. Millions of people live with diabetes, and many do not know they have it because symptoms may develop slowly. Early diagnosis is important to prevent complications. Several factors increase the risk of developing type 2 diabetes. The most important risk factor is overweight or obesity, especially excess abdominal fat. Physical inactivity reduces insulin sensitivity. Eating foods rich in sugar and unhealthy fats increases the risk. Family history also plays an important role. Other risk factors include increasing age, high blood pressure, abnormal cholesterol levels, polycystic ovary syndrome, gestational diabetes, smoking, stress, and lack of sleep. Many of these risk factors can be prevented through healthy lifestyle changes. The development of type 2 diabetes occurs in several stages. First, genetic and environmental factors lead to insulin resistance. In insulin resistance, muscle, liver, and fat cells do not respond properly to insulin. To compensate, the pancreas produces more insulin. This keeps blood sugar normal for some time. Eventually, the beta cells become exhausted and cannot produce enough insulin. As insulin production decreases, blood glucose rises. Persistent hyperglycemia damages blood vessels and organs, leading to serious complications. In a healthy person, food is digested into glucose. The pancreas releases insulin. Insulin binds to receptors on body cells. Glucose enters the cells and blood sugar remains normal. In type 2 diabetes, insulin may still be present, but the cells do not respond effectively. As a result, glucose cannot enter the cells properly. Blood glucose rises while the body's cells remain deprived of energy. The symptoms of type 2 diabetes usually develop gradually. Common symptoms include excessive thirst, frequent urination, increased hunger, fatigue, blurred vision, slow healing of wounds, repeated skin or urinary infections, and numbness or tingling in the hands and feet. Some patients may have no symptoms for years, making regular screening very important. Doctors diagnose type 2 diabetes using blood glucose tests. A fasting plasma glucose level of 126 mg per deciliter or higher suggests diabetes. A 2-hour glucose level of 200 mg per deciliter or higher during an oral glucose tolerance test also confirms diabetes. An HbA1c level of 6.5% or higher indicates diabetes. Random blood glucose above 200 mg per deciliter with classic symptoms also confirms the diagnosis. After diagnosis, blood glucose should be controlled to reduce complications. Most adults should maintain an HbA1c below 7%. Fasting blood glucose should usually remain between 80 and 130 mg per deciliter. 2 hours after meals, blood glucose should remain below 180 mg per deciliter. Targets may differ depending on the patient's age and medical condition. If diabetes remains uncontrolled, serious complications develop. Microvascular complications include diabetic retinopathy affecting the eyes, diabetic nephropathy affecting the kidneys, and diabetic neuropathy affecting the nerves. Macrovascular complications include coronary artery disease, heart attack, stroke, and peripheral artery disease. Acute complications include hyperosmolar hyperglycemic state, also called HHS, and drug-induced hypoglycemia. Proper glucose control greatly reduces these complications. Management of type 2 diabetes begins with lifestyle modification. Patients should eat a balanced diet rich in vegetables, fruits, whole grains, and lean protein. Regular physical activity for at least 150 minutes every week improves insulin sensitivity. Weight loss significantly improves blood glucose control. Doctors commonly prescribe metformin as the first-line medicine. Other medicines include sulfonylureas, DPP-4 inhibitors, SGLT2 inhibitors, GLP-1 receptor agonists, thiazolidinediones, and insulin when needed. Treatment should always be individualized. Type 2 diabetes is largely preventable. Maintaining a healthy body weight, eating a balanced diet, exercising regularly, avoiding smoking, managing stress, and getting enough sleep all reduce the risk. People with prediabetes should have regular health checkups because early intervention can delay or even prevent diabetes. Let's summarize. Type 2 diabetes is caused mainly by insulin resistance and relative insulin deficiency. It develops gradually and is strongly associated with obesity and lifestyle factors. Unlike type 1 diabetes, insulin is usually still produced in the early stages. Healthy lifestyle changes, regular monitoring, and proper medications help patients live long and healthy lives. Remember, early diagnosis and good glucose control are the best ways to prevent complications. Follow for more easy-to-understand medical animations and pharmacy education.